According to Johns Hopkins University, the U.S. now has more than 1 million confirmed coronavirus cases. Several states have already begun phased reopenings and others are set to follow. But many health officials say there isn't enough testing for states to reopen in a safe manner, with the U.S. trailing other nations in per capita testing rates. It all comes as President Trump called Monday for ramped up testing across the country. Scott Beadle has the story.
Today we're releasing additional guidance on testing to inform the states.
President Trump laying out his administration's blueprint for states to handle increased coronavirus testing, which experts say is critical for states to safely reopen. Trump telling states they'll have to pull their own weight in terms of testing.
States should unlock their full capacity, expand the number of testing platforms, establish monitoring systems to detect local outbreaks, and conduct contact tracing.
As far as the tests themselves, the White House says the federal government is to act as the, quote, supplier of last resort. According to a White House official, the goal is for states to test a minimum of 2% of residents, with a priority on vulnerable groups and emergency workers. Antibody testing, another tool to help track the virus, was also mentioned as part of the new plan at Monday's briefing.
Really ensuring that the antibody tests that are utilized and recommended by both FDA and CDC have high quality in predicting both exposure to the virus and antibody development.
Those comments from White House Coronavirus Response Coordinator Dr. Deborah Birx coming as the World Health Organization cautions that having coronavirus antibodies does not necessarily equal having immunity. I'm Scott Beadle.